This video will teach you how to do the OMM technique known as cervical stretching. The purpose of this technique is to stretch out the long restrictors of the patient's neck. If you remember from posterior cervical soft tissue, another OMM technique, it has a long name, so it treats the short restrictors. Cervical stretching, the technique I'll be showing you in this video, however, has a short name, meaning it'll be treating the long restrictors. So remember, the length of the name is opposite what it treats. Another thing this technique does is incorporates myofascial release to increase venous and lymphatic return in the neck, but the main purpose of it is to stretch out those long restrictors of the neck. To do this, your patient relax, you'll lift up the patient's head, and you'll cross your arms under the patient's head, like so. Now there are a few different variations of this technique. We'll start with the most basic, and that is, you'll take the patient's head into flexion, meaning you'll lift it off the table until you reach a barrier. You'll then hold in this position until you can appreciate a release and take the patient even further into flexion or even further into their stretch. Another variation is to have the patient push their head back in what is known as muscle energy. You'll do this for a 3 count, 1, 2, 3, and then have the patient relax. You'll wait for a second and take the patient to another barrier. You'll then repeat. 1, 2, 3, relax. Make sure you wait for this second before you take the patient into the next barrier. One more time. 1, 2, 3, relax. And when the patient pushes down, they only need to do about 10 pounds of pressure. It doesn't need to be a big push. And I'll take that patient to the last barrier. You'll notice as I did that throughout the muscle energy technique that the patient's head stretched considerably more than it did in its original position. And now let the patient's head fall down. Another variation of this is to do side bending and rotation rather than just flexion. To do this, we'll elevate the patient's head, cross one arm under the patient's head, and take your other arm on the side of the patient's head and side bend and rotate away. You can elevate a little bit with your underneath arm. You're really just trying to reach a barrier or a stretch for these muscles in the patient's neck here. You can do it just like with flexion. You can either hold it at the barrier until you appreciate a release, or you can carry out muscle energy in this variation. For the sake of time, I won't actually do it. But to show you the opposite arm, you then would have the left arm under the patient's head and your right hand on the side of the patient's head. Side bend and rotate away, lift a little bit with the underarm until you reach that barrier. You could then do muscle energy or just hold it here and follow that barrier up as the patient stretches. And that is cervical stretching.